I would like to start by thanking His Excellency Prime Minister Prayuth Chan-o-cha for his country statement at the UN General Assembly high-level meeting to end HIV and AIDS, and the Deputy Prime Minister for his leadership of the National AIDS Committee, demonstrating commitment at the highest levels in Thailand to end this global pandemic. On behalf of the UN, I would also like to express our deepest respect and gratitude for Her Royal Highness, Princess Soam-sa-wali, for her leadership and support to people living with and affected by HIV. We are also grateful for the government's unwavering commitment to the AIDS response. As you're aware, the UN Secretary General has emphasized that AIDS is unfinished business, and ending it as a public health threat by 2030 is possible. UN member states have adopted the 2021 Political Declaration on HIV and AIDS, which includes bold new targets to be achieved in the next 5 years. The declaration calls for programs to adopt new targets that ensure 95% of people at risk of HIV use the combination of HIV prevention services, while further reaching 95% of people living with HIV to access treatment. It emphasizes a focus on young key populations, placing a greater emphasis on community-led provision of services so that 80% of prevention services for key populations are provided by host communities. It also reaffirms the commitment to end inequalities. This year marks 37 years since the first case of AIDS was reported in Thailand. Today, it is estimated that 500,000 people are living with HIV, with 12,000 HIV-related deaths annually. There are 18 people newly infected with HIV daily in Thailand, which is more than the national target, and which threatens the epidemic to continue as a public health threat over the next 2 or 3 decades. The National AIDS Program has saved and protected millions of lives from HIV infection. With strong health system, HIV services fully integrated in the universal health coverage, the strong partnership with communities, and effectively leveraging innovations, including the pre-exposure prophylaxis, Thailand is well positioned to achieve the goal of ending AIDS by 2030. Community-led responses is a proven, effective intervention and critical solution for Thailand. For example, more than 60% of pre-exposure prophylaxis users are reached by community-led HIV services, demonstrating impressive results, with the uptake increasing from less than 3,000 users in 2018 to greater than 20,000 in 2021. I would also like to congratulate Thailand on developing a national, multisectoral and costed action plan to end all forms of HIV stigma and discrimination. At the UN General Assembly high-level meeting, Thailand committed to scaling up innovations, delivering services based on new technologies, and implementing a user-friendly and rights-based package of services for all in need. What is also commendable is Thailand's leadership is that leveraging South-to-South collaboration, and in particular with TICA and others, to actively promote innovations to end AIDS. For the UN, the HIV program is a key priority in the cooperation framework, which is founded on principles including leave no one behind, human rights, gender equality, sustainability, and resilience. It is time to transform the HIV response to meet future challenges and energize a stronger political will. Thank you again for the opportunity to join you at the World AIDS Day virtual conference.